My name is Kathleen Nemer, and I'm a dermatologist and Mohs surgeon practicing in St. Louis, Missouri at Laser and Dermatologic Surgery Center. Today I'm going to talk to you about the most common types of skin cancer and how you can spot them. Okay, here we go. The three most common types of skin cancer are basal cell carcinoma, squamous cell carcinoma, and melanoma. Tanning can increase the risk of all of these skin cancers. So the next time you're thinking about getting that golden glow, you may take a moment to think twice about what you're paying for. We're going to start with basal cell carcinoma. Basal cell carcinoma is the most common skin cancer. It frequently develops in people who have fair skin. People who have darker skin can also get basal cell carcinoma as well. Basal cell carcinomas often look like a skin-colored round growth, a pink pearly bump, or a pinkish patch of skin that does not go away. They can have this pearly look to them, and you can see some photos here that's kind of shiny, and they can also have blood vessels in them that feed the skin cancer, and these are the little red lines that you see in these photos. Basal cells usually develop after years of sun exposure and or indoor tanning. They are most commonly found on the head and neck, the ears, the arms, but it can be found anywhere on the body, including the legs, the chest, and the back. Early diagnosis and treatment of basal cell carcinoma is important because while they're slow growing, they can grow to become locally destructive, and they can grow deep, penetrating nerves and bones, and can cause damage and disfigurement. The next skin cancer we're going to discuss is squamous cell carcinoma. This is the second most common type of skin cancer. Squamous cell carcinomas also frequently develop in areas of chronic sun exposure in people who have fair skin. These look like a pink firm bump, a scaly patch, or a sore that does not heal. They can often be tender and grow quickly. As I mentioned, they form in areas of frequent sun exposure like the face, the ears, the hands, and the arms. But again, just like basal cell carcinoma, they can develop anywhere on the body, including the legs and the back and the chest. Early diagnosis and treatment of squamous cell carcinoma is also very important because they can grow deep and they can grow rapidly and they can spread to other parts of the body. Before we move on to the next type of skin cancer, I want to take a moment to talk about a pre-skin cancerous growth called actinic keratoses. Now, if you've ever visited your dermatologist, you may have encountered these because they're quite common. These are pre-skin cancerous growths, and if allowed to develop, they can turn into squamous cell skin cancer. They often look like dry, scaly patches of skin. You can see examples of them here. And oftentimes, you can sometimes feel them better than you can see them. So if you're rubbing your hand over your face, you could feel like a little bump or something that looks scaly. That could be an actinic keratosis. And while they are not skin cancer, they are important to treat because they can develop into the squamous cell skin cancers. There are multiple ways to treat these, the most common being liquid nitrogen therapy, which is the freezing mechanism, which some of you may have experienced in the office of your dermatologist. Other ways to treat these are topical creams and light therapy. Now we're going to review the third most common type of skin cancer, which is melanoma. And this is often the most dangerous type of skin cancer because it has the ability to spread. Melanomas can develop within an existing mole, or they can develop in a new mole that arises that you've noticed that looks like a dark spot different from the rest of the moles on your skin. Early diagnosis and treatment is critical to prevent melanoma from spreading to other parts of your body. We're going to review the ABCDEs of melanoma to help you spot a melanoma in its early phases and have it removed and treated. A stands for asymmetry. So one half of the mole does not match the other. You can see in this photo is a melanoma. You can see here that it is asymmetrical. It's not a perfect round circle. B is for border irregularity. You can see in this photo that the edges are ragged, notched, kind of blurry. They're not smooth. C is for color. The color of melanomas often vary within the mole itself. So you can have shades of light brown, dark brown, and red and pink, just like you see in this photo. Melanomas, the D is for diameter, and melanomas are oftentimes more than 6 millimeters, which is the size of an eraser on a number 2 pencil. And while this is a general rule, you can still have melanomas that are smaller than this. And E is for evolution. So this means that the mole is changing over time and it looks different than it has in the past or from your other moles. And sometimes we call this the ugly duckling phenomenon, where it's a mole that just doesn't look quite right. It doesn't look like your other moles. So I'd like to conclude by encouraging all of you to wear sunscreen, because that is one of the most important things you can do to protect yourself from the sun and from getting skin cancer. In addition to sunscreen, you can wear photoprotective clothing like hats and long sleeves and UPF clothing. I wanted to highlight one of my favorite sunscreens here, which is called ELTA MD. And ELTA MD has a line of sunscreens, and some are tinted, so they have a nice bronzing effect, and some are non-tinted. Here I've showcased the UV Clear on the left, which has a tinted and a non-tinted version. Next is the UV Daily. And then on the other side is the UV Elements and the UV Physical. So what's most important is that you find a sunscreen that you like and that you're going to wear, because that's the most important aspect, is that you wear it. And now I can take any questions that you may have. Don't see any questions. Oh, here's some questions. Okay, let's see. How often should a person have a skin check? That depends on who you are and how many skin cancers you had. So generally, once you hit about age 40, you should get a skin check about once a year. But if you have not ever had skin cancer before, you can talk to your dermatologist about how often they think you should come. Now, if you've had a lot of skin cancers, then sometimes you're going to come every 6 months or even every 3 months. So that sort of just depends on how often you get skin cancer, and that's something you'd want to talk to your dermatologist about. But if you've never had a skin check, you should probably get one just as a baseline. Let's see what else we have. How much sunscreen should you use? Well, you want to apply enough to coat the skin. So, a thin layer would be appropriate, but the important aspect to that is that if you're sweating outside, you're going to need to reapply. So even though you put it on at the beginning of the day, if you're outside working, it's hot, you're going to want to reapply multiple times because you could sweat it off. The same thing as if you're getting in a pool, you could, even though they say that they're waterproof, some of it can still come off in the pool. So you should be just reapplying consistently. What else? Does the best sunscreen for us change as we age? Not necessarily. There are a few different types of sunscreen. The main two types are physical blocker sunscreens and chemical blocker sunscreens. So physical blocker sunscreens are made from zinc oxide and titanium dioxide. And those are the sunscreens that just sit on the top of your skin and there's no chemical reaction to make them effective. And those would be the safest type of sunscreen, and those would be the ones that I would recommend the highest. And ELTA MD, which I mentioned, they have a lot of physical blocker sunscreens. Let's see. Oh, okay, this is a good one. I work in a basement and don't have much sun exposure. How often should I apply the sunscreen? Well, even if you work indoors, it would be advantageous to apply a sunscreen on your face every day, Because say you're going to go out and take a run to the grocery store, you're going to go pick up your child from school, you're going to be getting outside and in your car, and you're going to be getting some sun exposure. So even though you work inside, I would still recommend wearing a sunscreen, especially on the areas that are going to be exposed, like your face and your ears. Are there any home treatments for actinic keratosis? Yes, so there's multiple treatments for actinic keratosis. There are treatments we can do in the office, like the freezing with the liquid nitrogen. The other option or other options include a cream that you can do at home, and that's something you'd want to talk to your dermatologist about, and they can give you more information. Do you use different sunscreen on your face in the winter versus the summer? I personally do not. I think no matter what time of year it is, you should be wearing a sunscreen. And as I mentioned, I think the best type of sunscreen to put on your face would be a physical blocker sunscreen. And the two ingredients to look for are zinc oxide and titanium dioxide.